in support of their COVID-19 response. The immediate payment of the PhilHealth claims contributed remain true in our mandate as your representatives in the lower chamber. We are committed to craft policies aimed to improve our healthcare system, which will ultimately develop into a more resilient North Luzon region. With our partnership and support, especially coming from the private medical stakeholders in our region, we join hands in safeguarding the health and welfare of our constituents as we respond to the challenges of the COVID-19 pandemic. On final note, I would like to take this opportunity to encourage amin nga kailian, gagayem, kababayan dito in Norte and all present in this meeting to get vaccinated for our safety, protection, and advancement to the new normal. Thank you and be safe. Diyos ti agina kada kayo amin. God bless us all. So we have 5 presentations, excluding the keynote statement of our representative or director of the Malasakit Program Office, Director Angelina Del Mundo. So the sequence of presentation, we will hear from Director Del Mundo, then to be followed by presentations of DOH Region 1, Region 2, DOH CAR, PhilHealth, and lastly, from the Private Hospital Association of the Philippines. So with that, may the chair recognize from the DOH Central Office, the Director of Malasakit Program, Director Angelina Del Mundo. Good morning po, ma'am.
Magandang umaga po sa inyong lahat. Isang mapagpalang umaga sa ating mga honorable na legislators or kinatawan mula sa Northern Luzon. On behalf of our cluster heads, Yusek Tong-an, Undersecretary Roger Tong-an, and Assistant Secretary Francie Laksamana, I'd like to convey our heartfelt appreciation and thanks to all of you for inviting us over to be part of your meeting this morning po. Okay. As the director of the MPO, I clarified this last night po if I still have to present to you, but I was just told that I will just give you a very brief background on or the service coverage that the hospitals or our indigent patients can avail of the service coverage. So I just would like to emphasize that we have currently these guidelines, the revised guidelines on the implementation of the medical assistance to indigent patients program, and this is under Administrative Order number 2020-0060, which was signed on December 23, 2020 by our beloved Secretary of Health, Secretary Duque. So I just will share with you the salient points of these guidelines, specifically on the service coverage. Nais ko po lamang na gently remind everyone on the service coverage. So ito po, we would like to emphasize here that the MAIP Program Fund shall cover the essential and life-saving medicines, services, and other medical products as prescribed by a licensed physician or health professional, such as but not limited to the following. So number 1 po, drugs and medicines included in the PNF and those which qualify for compassionate drug use in compliance with the criteria or requirements set by the FDA. And number 2, included din po dito ang laboratory. Okay. So laboratory, imaging, radiological and other diagnostic procedures. Included also here is the blood and other related blood screening. Number 4, all clinically indicated medical, surgical, high-risk cases of obstetrics, gynecological, ophthalmological, dental, implants, medical devices, and the like. And then this one, ito po yung gusto rin naming ma-emphasize, in case of non-availability of clinically indicated drugs and medicines, services, and procedures, and lack of available beds in the government health facility as certified by the chief of hospital or his or her designated official, the concerned health facility may enter into a MOA with DOH license and PhilHealth accredited private health facility or government facility, other government facilities to provide the needs of the patient and charge to MAIP program funds. Ayun po. And may idinagdag po kami dito sa ating revised guidelines that because it is explicitly stipulated in the GAA, the CHD may now enter into a MOA also, like our hospitals, our government-run hospitals, with private partner health facility for health and medical services for indigent and financially incapacitated patients. But then, of course, subject pa rin po ito sa ating conditions um, or a certification to be issued by that concerned hospital. So, ang gusto po naming malinawan lang po dito ng lahat ay yun pong ating pasyente should still, go to any government hospital for that matter, so that if ever the services needed are not available or there are no available beds, that particular hospital chief or any authorized official of that hospital can issue a justification or a certification why to attest to the fact why this patient was referred to a certain private hospital. So yun po. Tama po, sir, your honorable chair, that other CHDs, specifically I can mention Metro Manila, CHD Metro Manila. I was able to confirm last night with Dr. Balboa, the head of the CHD Metro Manila, that they have started, trying to enter into UMOA with certain Metro Manila hospitals. But yun nga po, in-emphasize din niya sa akin, she confirmed with me that this will not they will not refer these patients unless there is a certification. So the MAI funds that will be downloaded to this particular private hospitals will still pass through the CHD Metro Manila for downloading. Ano po? Pero ang magiging proseso po is that parang it's on a reimbursement basis, no? Hindi po yung like the request of our legislators to download certain amount or funds to certain LGU hospitals. Okay po yan, diretso tayo because we really cater, indigent patients to these LGU hospitals. Pero dito po sa private hospitals, parang ang lalabas po dito is that on a reimbursement basis. There is a MOA between a CHD, any regional office for that matter, but it is stipulated there that probably there will be a certain credit limit or something to that effect. Like if let's say the bill reaches 500,000 for any particular patient, then the private hospital can bill now the CHD. And then the CHD will now process the downloading of funds to these private hospitals. So yun po, sir. Apo. So maraming salamat po. So far, yun po yung mga salient points under the current revised guidelines on the implementation of our MAI funds. Maraming salamat po.
Thank you very much, Director Del Mundo. The chair would like to remind the members to just list your names if you want to manifest and ask questions during our open forum. And before we move to the next presentation from Dr. Valeriano Jesus Lopez, Regional Director of DOH Region 1, the chair would like to acknowledge members of this committee who have joined us. Representative Sani Mangawang of the Lone District of Kalinga, Deputy Speaker Deogracios Victor Sabelliano of the 1st District of Ilocos Sur, Representative Luisa Loren Cuaresma of the Lone District of Nueva Vizcaya, Representative Faustino Michael D. of the 5th District of Isabela, Representative Sandra Erigel of the 2nd District of La Union, Representative Tyron Agabas of the 6th District of Pangasinan, Representative Tony Pet Albano of the 1st District of Isabela, Vice Chair Joseph Jojo Lara of the 3rd District of Cagayan, Representative Ino D of I think the 4th District of Isabela, and Representative Jocelyn Tulfo of Party List Act CIS. The chair would now like to recognize for his presentation Director Valeriano Lopez of Region 1. RD Lopez, you are recognized for your presentation.
Good morning po mga minamahal namin na mga honorable congressman. Salamat po sa opportunity na to be able to present to you the status of utilization for medical assistance for indigent patients or MAI program for 2020 and 2021 for Region 1. So this is Marvin Belio speaking. Okay, for the status of MAI utilization for 2020, almost all of the different hospitals in the region have already utilized their MAI appropriations at 100% utilization. But of course, for Ilocos Norte, there are still hospitals that have not utilized the fund, like Don Josepo Marcos District Hospital. Wala pa pong report. Roque Ablan, 44%, Lawag City General Hospital, 55%. For Ilocos Sur, Candon has utilized it fully at 100%, together with Ilocos Sur District Hospital in Narvacan and Ilocos Sur District Hospital in Sinaid. The hospitals which have not still utilized fully their funds include Ilocos Sur Provincial Hospital,
Integrated Memorial Hospital.
Okay. Yeah. Candon, 89%. Gabriela Silang, 52%. Tagudin, wala pa pong report. Okay. And then sa Magsingal, 62.5%. Now we move on to La Union.
Weak ang sound.
Comsec Karen, could you mute
Yes, sir.
others
Muted na po lahat ng other participants.
presenter na lang yung naka-on yung
Yes,
mic.
sir.
Thank you. ARD.
Okay, for La Union, sir. Isa na lang po ang hindi naka-utilize na fully ng kanilang funding. Ito po yung Nagilian District Hospital at 75%. 100% na po yung Palawan, Caba, La Union Medical Center, and Rosario District Hospital. Now for the province of Pangasinan, marami na rin po ang naka 100% to include the Singan, the Sol, mga Tarem, as well as Bolinao. Yung mga hindi pa nakaubos ng pera is Eastern Pangasinan at 76%, Lingayen 82%, Panawag 68%, Umingan 93%, Western Pangasinan 53%, and Pangasinan Provincial Hospital at 96.88%. So yun po yung ating fund utilization. Sana maubos na po itong pundo kasi nandyan na yung 2021 budget. Okay, for 2021, Maib, isa lang po yung nakatapos ng MOA sa lahat ng hospital. Kung makikita niyo po, 2020. Okay. Sa lahat ng hospital dito sa Region 1, only Ilocos Sur Provincial Hospital at Gabriela Silang has been able to finish their MOA signing. Kaya meron pong fund utilization dito na 24.10%. All the hospitals, aside from Gabriela Silang, have not yet firmed up the MOA. Kailangan po daw ng sangguniang panlalawigan na mag-undergo ng resolution to allow the provincial governor to sign the MOA, kaya wala pa pong fund utilization sa lahat ng hospital, maliban po sa Gabriela Silang. Yun lang po. Marami pong salamat.
Thank you very much, ARD Marvin Bello, for your presentation. Now let's move to the second presentation by DOH Region 2, Dr. Faith Alberto, Assistant Regional Director. Ma'am, you are recognized for your presentation.
Yes, good morning, sirs. I would like to request our MAIP coordinator to present now. Dr. Adele, please, if you allow, sir. Thank you.
Yes, yes, please do so. Dr. Abel is recognized.
Good morning. Can you see my slide po?
Yes, see your slide.
Okay. So, good morning, Dr. Acosta, the MAIP coordinator of CVCHD. So, yesterday po, we asked the Secretariat what to present, and we were informed that the 2021 MAIP fund utilization will be presented. So, this is what we came up with. So, for the 2021 MAIP funds, we received a total of 49.6 million from the Congress, 13.5 of which has been transferred, and 6.1 million has been utilized. So, that's around 12%. For the 12% utilization, we were able to serve 180 patients. We're still waiting for the MOA for the 36.1 million. The main challenge here for us is that the turnaround time for the signing of MOA for both municipal, especially district hospitals, usually takes around 2 to 3 months. So these were the proponents who gave allocations for CVCHD. For the details, we were able to receive from MEBG party list and Congressman Alan T for the following hospitals, a total of 17.5 million. From Congressman Alisa Tan for the following hospital, a total amount of 8 million pesos. From Congressman Ed Christopher Go for the following hospitals, a total amount of 3 million, also waiting for the MOA. From Congressman Argel Kabatbat, 500,000 pesos. Congressman Juni Kuwa for QPMC for 20 million, also both waiting for the MOA. And last, Congressman Eduardo Villanueva for the following hospitals, total amount of 600,000 pesos. Challenge that we had, this is our ways forward. First is to involve our DMOs or our DOREPs in the facilitation of the signing of MOA. Second is to meet all the MAIP coordinators on a weekly basis. And lastly, to require the MAIP coordinators to submit to us weekly utilization report. That's all pa. Thank you.
Thank you very much, Dr. Adelina Acosta, ARD of Region 2, for their presentation. Third presentation will be coming from DOH CAR to be delivered by Dr. Ruby Constantino, Regional Director.
Honorable Congressman Ramon Gueco III, Chairperson.
You're recognized, ma'am.
Thank you po. Honorable Congressman Ramon Gueco III, Chairperson. Members of the Special Committee for North Luzon. Of course, to our congressman present For CAR, we have Congressman Elias Bulog Jr., Honorable Congressman Maximo Dalog Jr., and also Honorable Alin Jesse Mangawang. To all the DOH officials, PhilHealth officials, and stakeholders, good morning. So allow me po to share my slide.
Director Ruby, you are
Oh.
situated in Baguio. You should, I'm here.
Okay. Congressman Marco.
Unless you want to move to Kalinga.
I was
No,
listening.
I'm just joking. I'm just joking.
I was listening to the acknowledgement po of the chairperson. So.
With the indulgence of the good Director Ruby Constantino, the chair would like to acknowledge the presence of Congressman Mark Go of the Lone District of Baguio.
I'm sorry, Mr. Chair. I got a note that our meeting is at 10 o'clock. So
it's okay. It's okay.
yeah,
Congressman.
I just had my power up just a few minutes ago.
Thank you, Congressman. So, Dr. Ruby Constantino, please continue your presentation.
So this is the updates on the implementation of the medical assistance indigent patients program as of May 29, 2021 in the Cordillera Administrative Region. So for the 2020, calendar year 2020, there was a total of 60,450,000 from 12 proponents allocated to the hospitals in the region. Of course, we included the admin expenses. 59 million or 98% was transferred and utilized by the hospitals and served a total of 4,817 patients. The remaining 1.2 million here is actually for Panupdupan District Hospital, 1 million, and 200 for Atok District, which is still for transfer to the recipient hospitals, pending their submission of the required documents like MOA, SB resolution, and of course the fund utilization report. For the details, Benguet General Hospital was the recipient of 2 allotments from Secretary Roque, amounting to 995, and these were all utilized and served 132 patients. From Senator Angara, he allocated 3 million for 3 hospitals, so 1 million each. However, only 2 million already transferred to Abra Hospital, Public Provincial Hospital, and Bontog Hospital, while the 1 million for Panupdupan is still for transfer. We just received their SB resolution last May 26, 2021. So we still have for transfer of 1 million. From Senator Aquilino Pimentel III, he allocated 1.7 million to 5 hospitals. 1.5 million were already transferred to the recipient hospitals, except for Atok District Hospital, 200,000, which is still for transfer, pending the utilization of least 50% of the previously allocated by Congressman Yap to the said hospital. From Senator Christopher Lawrence Bongo, 10 million was allocated to Benguet General Hospital, and this was utilized and served 594 patients. From Congressman Eric Goyap, we have a total of 30,940,000 and transferred to 6 hospitals in Benguet Province. We have already transferred. These hospitals already utilized 26.9 million, of which 2,094 patients were served. The remaining 3.9 million is still for utilization by the hospitals Atok, Dennis Molintas, Itugon, Kapangan, and Northern Benguet District Hospital. From Congressman Maximo Dalog Jr., 4.1 million was allocated and transferred to 5 hospitals. 3.8 million was already utilized by the recipient hospitals and served 412 patients. Still to be utilized is 290,000 by Barleg and Paraceles District Hospital. So from Congressman Elias Bulog Jr., 1.198 million was given to Far North Luzon, utilized and served 296 patients. From Congressman Fong Juan, 4.9 was given to Benguet General Hospital, and 376 patients were served. From Congressman Alin Jesse Mangawang, 2 million was given to Kalinga Provincial Hospital, utilized, and 190 patients were served. From our party list, Co-op NATCO party list gave 49,500 to Abra, 19 patients were served. Kalinga Party List gave 99,000 to Benga Chen, which served 10 patients. And PhilReca Party List 400,000 given to Kalinga Provincial Hospital and 293 patients. For our calendar year 2021, a total 112 million was allocated from 7 proponents to different recipient hospitals. 84 million or 76% was transferred to the recipient hospital, which is Benga General Hospital, and already served 1,829 patients. These allocations came from Secretary Roque, Congressman Yap, and from Kalinga Party List. The remaining 26 million are still for transfer, pending submission of the required documents like MOA, ESPA resolution, or fund utilization report. So this is the details from Secretary Roque, already transferred na 499 to Bengache. And this is not yet utilized by the hospital because the hospital is utilizing the big amount coming from Congressman Yap, which is a total of 99 million, and then 84 million was transferred already. The balance and served already some patients. The balance of 50 million will be transferred once the 11 million previously transferred to the hospital will be liquidated. From Congressman Maximo Dalog, we have here 2.5 million allocated for 5 hospitals. This is still for transfer, pending submission of the fund utilization report of the previously allocated funds. Except for Barlig here, Barlig, wherein I just signed the voucher yesterday, so this will be transferred maybe today or tomorrow. And then the rest of the hospital, we are still waiting for the liquidation report of the previously transferred funds. As per our coordination, the latest coordination is that all of the fund utilization report of Bisao, Bontoc, and Paraceles are already with the provincial accountant for review and signature. While for Kalinga, it is still with the accountant of the hospital. So hopefully by next week, we will receive this fund utilization report and transfer these funds within the week. For Congressman Arias Mangawang, 2.5 million was allocated to Kalinga and still for transfer pending the fund utilization report of the hospital. And this is the 400,000 given by PhilReca, which needs to be liquidated first. And then for Kalinga Party List, 200,000 already transferred to Benga General Hospital. This is already transferred to the hospital but not yet utilized because, as I have mentioned, the hospital is still utilizing the allocation from Congressman Yap. You have Co-op NATCO Party List. This is not yet transferred because the final name of the recipient was only given to us last May 27, 2021. From the DOH, 6 million was allocated to 4 hospitals. This is still for transfer pending the submission of the fund utilization report. For Panukdupan here, we just received the MOA, so we will be processing the immediate transfer of the fund to the recipient hospital. I think this is my last slide. Thank you very much.
Thank you. Thank you very much, Dr. Constantino. The next presentation will be from PhilHealth. Walter R. Bacareza, Area Vice President for Area 1. Mr. Bacareza, you are ready.
Mr. Chair.
Yes, the Honorable Quaresma.
Yeah, thank you very much and good morning. Mr. Chair, are we done already with the MAIP utilization? So we are now on the second agenda, Mr. Chair.
Yes, Honorable Quaresma, we are down to our last 2 presentations.
Can we now ask question with regards to MAIP utilization? Because in the presentation
With the judges of the Honorable Quaresma, ma'am, could we just finish mga siguro 10 minutes na lang ito? So we proceed with
for PhilHealth, is it just 10 minutes, Mr. Chair?
Yes, about 10 minutes, 10 to 15 maximum.
Okay, Mr. Chair, thank you.
Thank you, Honorable Quaresma. So let's proceed with the presentation of PhilHealth. Mr. Bacareza, you are recognized.
Thank you, sir. Good morning po, Honorable Legislator. Legislators. Good morning po, Mr. Chair. Good morning, fellow health workers, and good morning po sa aming partner hospitals. Thank you for inviting us po so we can report to you. I am joined po by our VP Adre of Region 1, our VP Dean Reynes of Region 2, and our VP Dr. Gadgad of Region CAR po. Relatively, this is a new team po, but we are committed to give you better experience and better service po sa PhilHealth. Una po, if I can share the slide po, my slides po. If I can show my slides po.
Comsec, could we share the slide?
Yes, sir. He could share na rin po.
Sir, thank you for inviting us, sir. Health is a big component to growth, to development, and to resiliency. And one of the biggest challenges talaga natin is health, no? And sa health,
Sir, parang wala pang share yung ano. Hindi ko na-share yung slide.
nag-a-adlib na lang po ako while waiting
Okay,
for...
sige.
Oo. In fact po, I think nakapila po sa mga bahay ng legislators natin, karamihan po, puro health problems po, ano? And I hope with the universal healthcare, sana po nabawasan na po yung mga problema sa walang pambayad sa hospitals, etc. etc. Baka hindi mawala lahat, pero sana mabawasan po ng malaki.
AVP, would you like me to share yung presentation na lang?
Yes po, please.
Okay po.
So ito pong slides po, it's a picture of a crucifix. Nakalagay, I have no hands but yours. This is how we look at our partner hospitals po. The only way for us to serve the public is through the facilities po, usually the hospitals po. So our next slide po. So that we formulated what we call as the combat plan. Why combat plan? Bakit gera ito against poverty? We think po, if we don't do our jobs well, people will actually die in the hospitals. Kaya kailangan po na magaling po ang ating trabaho. So first po is our enhanced external experience. We are very, very conscious that the only way for us to have happy members, happy Filipino, is to have happy facilities. And to make sure that the facilities are happy, the financial lifeblood must be continuous and free-flowing. So we propose po that, next slide po. So we are happy to report that in 2017 po, most trusted social protection agency by ION po ang PhilHealth. And in 2020 po sa Novotrends, 87% satisfaction level po. We are in constant coordination with ARTA, the Anti-Red Tape Administration, for our frontline services and turnaround time processes, especially yung payment po. We have also been certified by ISO. Next po, please. So ito po yung mga namin some of our proposals in order to let our people know na PhilHealth is garantisado na under the universal healthcare. Libreng konsulta with our consulta facilities. Coming soon na po yung consulta facilities. We are piloting it. Libreng panganak, sometimes in coordination with financial assistance in selected pilot areas po, in coordination with LGUs. Next po. When it comes to membership, sir, we are happy to report that tinapos na po natin yung membership problem, no? Under the universal healthcare, everybody should be able to avail of PhilHealth benefits. So our mandate po is to cover all Filipinos. Maybe have next slide po, ma'am. So our mandate is to ensure the kalusugan po ng bawat Pilipino po. Next. So ito po, noong araw, yung mga buntis lang ang ano na, yung una, the LGUs, the congressmen, we asked them to sponsor members no, in PhilHealth. Pero under the universal healthcare, lahat na po, hindi lang yung buntis, hindi lang senior citizens, etc. etc. Ang concern po namin, there are still cases, a few cases in the hospitals, nagsasabi, pwede ba kami maka-avail? Or may mga sad stories na na-encounter namin na hindi pa rin sila pinapa-avail ng hospitals. So we would like to remind everybody that the membership war is over. All Filipinos can now avail under PhilHealth. Next slide, please. But if you want to see the details po, ito po yung registration rate. Sa CAR po, napakataas po ng registration rate. Congratulations po sa team nila, Dr. Gadgad po. Next slide, please. Sa collection po, these are our reports of collection. Another star for CAR. In 2020 po, napakataas nila. Line of 9 naman po lahat. So, I think we're okay in the collections side. Sa collection efficiency naman po, of course, we are... next slide, please. Sa collection efficiency naman po, although we are affected by COVID and the challenge of the all can avail, yung all can avail, meron din siyang negative side because some of our self-employed members are parang ayaw na magbayad dahil anyway, they can avail. So that's one of the biggest challenge of PhilHealth on how to make them want to pay. Next slide, please. So these are the strategies that we would like to adapt or are working on. We believe that the Filipino people, although all can avail, would like to pay their premium, but we'll just make it easy for them to avail of their premiums. So we are now working with bayad centers and EasyPay and the likes. And sana yung SMS payment. May grupo po kaming nagtatrabaho niyan. It's called Member Management Group. Headed by one of the best, I used to be headed by one of the best executives, si Oscar Abado ng Region 2. Next po, we go to accreditation. Next slide, please. These are our accreditation statistics po. Ranging from 68 to 82% of LGUs with maternal care facilities or maternal care package facilities. Next po. For TB dots po, these are our facilities accredited, no? And ibig sabihin po nito, for example, for CAR, 35% of our LGUs have at least one TB dots facility. So I would like to call on our partner Department of Health na sana po, according to the reports coming to me, nakalagay po, ang problema po nila is yung license to operate. The policy po is that automatic na po ma-accredit sila basta meron silang LTO at mag-sign po sila ng MOA with us. So tingin namin sa LTO po kung pwede po nating matingnan. Next po, next slide. So these are the strategies po. We will have accreditation month to make sure that everybody is accredited before January. Because before October, so that by January we are sure that all of them are on board. And we will text blast the doctor so that they will be reminded of their accreditation. Next po, ito na po ang crucial for our partner hospitals. Availment. Everybody must be able to avail of their benefits when they get to the hospitals. So we are very happy to report na isa sa pinakamalaking claims po ay nasa Area 1 or North Luzon and Central Luzon. So this is our report in Region 3A, one of the highest, in fact, highest region to be receiving claims, no? 622, or in 2020 po, we received in Region 3A alone 1 million claims, followed by Region 1 at 675 claims. Region 3B at 563,000 claims. Region 2 at almost 400,000 claims, and in CAR po is 300,000 claims. Next po. Ito po yung payment natin. Nakita niyo po na sa Region 1, malaki po ang nabayad nila for 2020. Kahit mas malaki sila. This will be reflected on the turnaround time later po. Next slide po. This is the figure on the return to hospital. So at the average in the country, we have about 7 to 10% return to hospital rate. Ito po yung claims na binabalik po namin sa hospitals for various reasons. And here are the reasons po. Next slide, please. Other documents required. Required document is unavailable, incomplete, inconsistent, or unreadable. Number 3, may discrepancies po. Number 4, may error in the CF4 XML for referral to service provider to fix and refile. Number 5, wala pong value been set subgroup. Number 6, required claims forms po hindi po na-submit. Number 7, submission of properly accomplished statement of accounts to PC 2016-005. Number 8, wala pong required moratory verification of secondary subgroup per DOH guidelines is required. Number 10 po, incomplete services rendition of claim. Next po,
Mr. Pacanesa?
Yes, sir. Yes, sir.
Yes, the chair will give you a 2-minute extension lang, no? Wrap up.
Yes, sir. Yes, sir. So ito po yung denied claims. Nakita nyo po na ang dinideny natin, konti lang po, no? Sabi ng hospitals, palagi po tayo nagde-deny, but the statistics show na konti lang po. In fact, in May 2021, of January to May sa 2021, konti na lang po, konti pa lang. Kasi hindi pa po tayo nasa middle of the year po, no? Historically, we have 1% to 5% with denied claims. And ito po ang reason. The reasons, next slide please. Case all and ito lang po, number 2 po, Mr. Chair, ang pinakamadali, yung filing and refile days is beyond statutory period. We are supposed to, the hospitals are supposed to submit to us in 60 or 120 days. Yung karamihan po, number 2, cause of claims being denied is po na these are the reasons po na hindi na deny po namin. Ito po yung strategies natin. Po dyan is with the hospitals. Meron po tayong project reach out. And yung po ngayon is quarterly reconciliation with the healthcare facilities. I would like to inform the chair po and our honorable legislators that the president of PhilHealth through the Chief Operating Officer, Attorney, ordered Area 1, tayo po ang area to pay for perfect our hospitals. And I would like to inform the body, sir, that we have started piloting it in a couple of hospitals in Region CAR and Region 3. Very soon, we will expand this reconciliation regions in North Luzon and Central Luzon. Region 1, 2, 3. Next slide, please. So this is the next po is the turnaround time of claims payment. This is very controversial because ito po ang palaging reklamo po ng ating partner hospitals, no, na mabagal daw ang. Let me show you the statistics po. These are our statistics from 2017 to May of 2021. So ang pinakamabagal po is 57 days in Region 3A, Pampanga. But if you can see po, sa Region 2, 34, sa CAR, 53, and sa Region 1, 53. Our target po is 60 days. So we are still within that 60 days despite of what's happening with the pandemic po. The sad story po is our processes are malaking factor sa processes natin o malaking part of our processes is still manual, especially the adjudication portion of our claims processing. But tama po yung sinabi po ninyo, no? We are about to embark in a project called DCPM or Debit Credit Payment Method, which will be available for Region 2 and CAR. Bakit po hindi kasama ang Region 1? Kami po ay limited to the orders coming from the IATF. So sabi ng IATF po, it's CAR and Region 2. Pero tapos na po yung Region 3 and Region 3B, NCR, ang tawag po nila NCR plus bubble. So yung sinasabi po namin DCPM, this is what yung na-mention niyo po kanina na payment of 60% of the claims po. Next slide, please.
Mr. Bacaresa, can you wrap up na?
Yes, sir. Ano na lang, konti na lang po. So ito na po ang ano namin, this is our claims for every month po from January to May of 2021. And no balance billing po, ito po yung stats natin pag na ibig sabihin walang binayad po yung ating pasyente sa hospitals. Next slide, please. And I am very happy to report, Mr. Chair and honorable legislators, that ito po yung ating CAR especially, special mention na 93% po hindi daw po nila pinababayad, Region 2 91, Region 1 88. Ang target po natin is 75%. So yun lang po, Mr. Chair. If you would like to know our anti-fraud efforts po, ito po last year. Ito na po, naibalik na po 99.28% of the facilities IRM po. We have about for CAR, dalawa na lang po ang hindi nakapagbalik na 100% for Region 1, 4, Region 2, 3. Pero 99%, almost 99% na po naibalik. Thank you very much, Mr. Chair. Yun na po, Mr. Chair.
Thank you, Mr. Walter Bacaresa, Vice President. So from the Private Hospital Association of the Philippines, the chair would like to recognize Dr. Rene De Grano, the president. Dr. De Grano, you have the floor.
Yes, Honorable Chair and members of the committee and other legislators present, Your Honors. Distinguished guests from the Department of Health, PhilHealth, hospital owners and colleagues, magandang umaga po sa inyong lahat. I am representing the private hospitals of the Philippines, incorporated as its president. For the past year, since the start of the pandemic in March 2020, the private hospitals have been very cooperative and willing partners in providing the necessary help in terms of healthcare services